Hi, Kevin Henry with Dental Economics. We're here today on a Skype call with Dr. Michael Nusbaum. And Dr. Nusbaum has created the only smartphone app that gives legal recordings of phone conversations between a patient and a doctor. And it's called MedXCom, right, Dr. Nusbaum?
Correct.
Well, tell us a little bit about the idea behind this app.
Right. Well, it actually started when one of my partners was contacted by a patient's wife, and he, based on the conversation, recommended that she take her husband to the emergency room. For whatever reason, she decided not to. Unfortunately, it resulted in a negative experience, and he had complications as a result. When they decided to sue, it came up that he said that he told her to go to the emergency room, and she denied that it ever took place. That's not the first time that's happened, clearly. And sometimes there's a component of misunderstanding of what was exactly said. In fact, I think during the trial, which, by the way, they found there was no cause, but during the trial, it actually came up, she said, well, he did tell me, but he didn't tell me how important it was to go to the emergency room. So she even backtracked on that. So here you have a recording now which basically protects both ends, really, from issues that could potentially arise from a miscommunication. And it's interesting, about 27% of all malpractice cases result as a miscommunication coming from a conversation, usually on the phone. And that's really where that came out of.
And I know that obviously you created this because of your background in the medical world. But talk about, you're talking about that this could also be applicable in the dental world as well, correct?
Absolutely. No question about it. For the same reasons I just spoke about, patients not following recommendations of a provider. There was one recently with a woman who had seizures, and her doctor told her not to drive. She drove, and she ended up killing some people, and she claims that she was told that she was able to drive, and now the doctors are on the hook. But even in the dental world, my father was a dentist. I discussed this with him too. He loved it. He thought it was terrific. Quite a few times you give out advice to patients and tell them what to do, and unfortunately they don't necessarily follow your instructions. There's also the possibility, and this is one of the things that we have on our end too, of sharing, of communicating, and actually discussing patient care with other practitioners. So whether it's showing them a lesion on their leg that's suspicious, or whether it's something in their mouth that you're not sure about, sharing that image and having a consultant come in and tell you what they think of it.
Talk a little bit, and you mentioned this a few minutes ago, but a little bit more about the legal ramifications of what this app can do to really protect the doctor or the dentist from malpractice or any kind of legal misunderstanding.
Right. Well, the conversation is not only recorded, but it can also be transcribed. In fact, that's one of the big features of our system. And most physicians on the system do use the transcription service. And what that does is it automatically converts the voice file into a voice-to-text transcription of the conversation, which you can now either archive into your electronic medical record, print out a copy and put into your paper chart, or in some cases also, if the patient has the MedXCom patient app, you can now push that conversation to the patient. So, for example, if I'm your patient, you gave me instructions on how to take care of a wound in my mouth, you could, at the end of the conversation as a doctor, push that transcription of that conversation to my app so that I can now review it, so that there is no question about what you told me to do. Maybe it was a long, drawn-out instruction of what I'm supposed to do, but it's there, and I can actually review it. There's no question about what you told me to do.
And actually, I think you answered my next question, but I just want to confirm, it seems like it goes rather seamlessly then into the patient's chart as well, so there is that record there on top of the record almost.
Exactly, and part of the app itself is meaningful use. So what we do is we actually link to existing electronic medical record systems. I think in the dental world there are about 3 of them that are the big ones that are out there. And it will actually push the information about that patient to the doctor's smartphone before the doctor even takes the call. And in the next version, I think it comes out July 15th, it'll also push the patient's picture. So for me, it's kind of hard for me to remember all my patients, but if I see the name and I see the picture, I'm definitely going to remember exactly who that person is. But reviewing that medical history, I can actually take a look and see about all that information before I even speak to the patient.
Well, tell our viewers about how long the app's been around, and you just mentioned some of your future plans with it, but where do you see this going from here?
Right. The app was actually launched to the general public at the end of February. It's been in beta testing since the end of summer last year. And went through quite a bit of beta testing and additional features. Probably the latest feature, the one that most people like, is the prescription reminder system, which is attached to our electronic prescription app. So at the end of the conversation, if you as a dentist have a conversation with your patient, you decide you're going to order some antibiotics for them. As soon as you're done with the conversation, you click prescribe. It opens up an electronic prescription app. It migrates all their medical information into the app. So it checks for allergies, checks for drug interactions, has the patient's preferred pharmacy already on file. You just select the drug you want, the dosage, strength, route of administration, the frequency, and it gets sent to the pharmacy. On the patient's app, the patient is now told Dr. So-and-so has prescribed such and such an antibiotic for you. When you get it filled, press here. So they go to the pharmacy, they get the prescription filled, they press that they've got it filled, and then it asks them to press when they're taking their first dose. It then asks them if they want a reminder for the next dose. And it'll actually remind them when to take the next dose. The feedback is for the doctor. If that patient doesn't get it filled, it'll alert the doctor, Mrs. Jones didn't get her prescription filled, or she's not taking her medication. And they can also put in any other medications they have. So, for you as a caregiver, you'll also see that the patient will be on other medications, but that's also an incentive for them to use the medication reminder system because they may be using it for other meds that they're on as well.
Very interesting. Tell our viewers where they can get the app. Is it available for Apple, BlackBerry, Android, all those?
Right, it's available for the iPhone right now,
Okay.
and it'll be available, and it's on iTunes, and it'll be available for Android between July 1st and July 9th.
Great. And it's MedXCom, right?
Correct.
Okay, great. Dr. Nusbaum, hey, really appreciate the time. Thanks so much. Sounds like a great app.
Thank you. My pleasure.